everyone, welcome back to the channel that is Professor of Pharmacy, Clinical Pharmacy with Namira Faruqi. Lecture 2, Technical Definition, Common Terminologies used in clinical setting and their significance such as Paediatrics, Geriatrics, Antenatal Care and Postnatal Care. We will discuss all of these in detail. Firstly, technical definition used by the clinical pharmacist. Clinical pharmacists focus on the application of pharmacotherapy and provision of patient-centered care. Pharmacotherapy is the treatment plan of the patient. Provision of patient-centered care is that to provide the best treatment and cure the disease, and that with the help of doctors. Day-to-day terms used by the clinical pharmacist. Number 1 is clinical pharmacy. Second, medication therapy management, MTM. Third, pharmacotherapy. Fourth, adverse drug events. Fifth, drug interaction. Sixth, pharmacokinetics. Seventh, pharmacodynamics. Eighth, therapeutic drug monitoring, that is TDM. Ninth, clinical decision support, CDS. 10th, formulary management. Now we will discuss all these 10 in detail. Firstly, clinical pharmacy. It is a specialized field focused on application of pharmaceutical knowledge, that the person should have the good knowledge about the drugs, its treatment, and best skills to implement, and ability to optimize patient outcome, that the outcome should be safe and effective treatment of the drugs and to provide the best therapy that the disease cures at early. Second, medication therapy management, MTM. Medication therapy management is to optimize drug use. That drug should be used wisely and properly. Second, assess patient medication regime. That the drug regime of the medicine should be according to the need of the patient only, right dose to be given. Third, identify medication related problems and solve them. That the medication related any problem occurs, it should be solved timely, that the cure is done properly. Third, pharmacotherapy. It is use of medications to treat and manage the disease. Pharmacotherapy is the treatment plan which is given to the patient. It should be right medicines to be given to manage the disease. It involves setting appropriate dose, that is the right dose. Dose in accordance to the age. The dose of the patient should be in accordance with the age. That pediatrics are given low dose. Monitor its effect. Daily effect of the drugs at frequent interval should be monitored to see that the patient is being cured or not. Therapy management if needed. Like when any ADR occurs to the patient, then the management of therapy is to be done wisely and correctly. Fourth, drug interactions, that is DI. Drug interaction is the effect of one medication has on the another. जब भी हम दो ड्रग्स एक साथ लेते हैं, या तो कुछ उसका बेनिफिशियल इफेक्ट होता है या फिर हार्मफुल इफेक्ट होता है. बेनिफिशियल इफेक्ट जो होता है वो एनहांस करता है थेरापेटिक इफेक्ट को, जो कि हमारे को इफेक्ट करता है, राइट प्रोवाइड करता है. सेकेंड, हार्मफुल इफेक्ट, दैट इज द साइड इफेक्ट, या रिड्यूस कर देता है इफेक्टिवनेस को. Side effect can be harmful or life threatening, so it has to be cured, or effectiveness should be high. Fifth, adverse drug event, ADE. Harm that occurred as a result of medication use. जो कुछ भी harm होता है medication use की वजह से. It includes कोई भी medication error हो सकता है, सही डोज नहीं दी, सही टाइम पे नहीं दी. साइड इफेक्ट, कोई भी साइड इफेक्ट नहीं होना चाहिए, वो हमें मिनिमाइज करना है. कोई भी एलर्जिक रिएक्शन नहीं होना चाहिए. अगर कोई एलर्जिक रिएक्शन हो रहा है तो उसको क्योर करना है सही तरीके से मेडिकेशंस प्रोवाइड करके. और एनी अनदर साइड इफेक्ट भी हो सकता है, मेडिकेशन एरर, साइड इफेक्ट, एलर्जिक रिएक्शन और कोई भी एडवर्स इफेक्ट हो रहा है, जो क्लिनिकल फार्मासिस्ट होता है वो प्रिवेंट करता है और मैनेज करता है एडीआर को बाय गिविंग द राइट ट्रीटमेंट प्लान टू द डॉक्टर्स. Number 6, pharmacokinetics, that is ADME, absorption, distribution, metabolism and excretion. In this we will check how the drug is being absorbed, metabolized, distributed and eliminated by our body. It helps in setting the appropriate dose regimen and what time the drug has to be given to the patient. Number 7 is pharmacodynamics, that is how drug produces therapeutic effect. What is the mechanism of action of that drug? How our body is responding to the drug. 8th, therapeutic drug monitoring, TDM. It is the measurement of medication concentration in blood. In this we will check the concentration of medication in our blood, at how much time interval it reaches in our blood. It helps in ensuring the safe and effective range of the drug. Commonly used for the drugs with a narrow therapeutic window. TDM को mostly use करते हैं the drugs which have therapeutic narrow window. That is the same small difference between therapeutic range and the toxic dose. 9th, clinical decision support, CDS. It is a computerized tool and the system. It is provided to the healthcare providers which gives information and recommendations. CSD, clinical decision support, एक ऐसा कंप्यूटर बेस्ड सिस्टम होता है जो इंफॉर्मेशन प्रोवाइड करता है अबाउट द ड्रग इन डिटेल टू द healthcare professionals. It improves medication safety and optimize patient outcome. With the help of this software and the system, we can provide patient the medication safely use and optimize the drug treatment according to the need of the patient. 10th, formulary management. Selection, evaluation and managing medication according to the need. Formulary is a book of drug. It is a list of medicines approved for the use. By the help of this, we can select the drug according to the disease of the patient, the effective drug accordingly. It ensures patient assess the safe drug, effective, that it should cure the disease at affordable treatment. That is, pocket friendly treatment should be given to the patient to cure the disease. Paediatrics, branch of medicine, deal with health and medical care of infants from birth to the age of 5, children from 6 to 11 years, adolescents 12 to 18 years. That is from birth to the 18 years. Paediatrics is derived from the two Greek words, that is pies means children, itrios means doctor or the healer who treats the children's. Common terminologies used in clinical settings for pediatrics with its significance. First, growth chart. These are the chart which are used to track child growth and development over time. With the help of growth chart, we see how the child is being growth and what is the development of the child over the time. It is used to access. With the help of growth chart, we can access the weight of the baby, height of the child and head circumference. By comparing this all height, weight, health circumference with the other children's of same age and gender. Second, vaccine. Vaccine help to protect children against various infectious disease like polio, mumps, hepatitis, etc. What is the work of the vaccine? That it stimulates our immune system and provides antibodies to fight against the disease. Whenever any disease occur, vaccines helps to fight against these. Number third, development milestone. It is a skill, behavior of the child. In development milestone, we see what skills the child is having and gaining. What is the behavior of the child? It is achieved at right time or not? Like walking. गर्ल्स जो होती हैं बहुत जल्दी सीख जाती हैं, बॉयज लेट सीखते हैं. ऐसा क्रॉल करना, किसको कितना टाइम लग रहा है, ग्रास्प करने की कैपेबिलिटी, लर्निंग कैपेबिलिटी कितनी है कितनी नहीं. फोर्थ, पीडियाट्रिक डोजिंग. Amount of medication to be given. Dosing is based upon age and weight. It should be ensured that the child should receive appropriate amount of medication according to its age and weight. Fifth, respiratory distress. It is the medical emergency. It is difficulty in breathing caused due to asthma, when our airways get inflamed, pneumonia, when air sacs of lungs get inflamed, bronchiolitis, that is the inflammation in the lining of bronchial tubes. Sixth is failure of thrive. Describe child who is not growing or developing. Failure of thrive is that when child is unable to grow or develop properly. It can be the cause of malnutrition when the child is not getting the appropriate nutrients. Delayed development. Child development and the growth is being delayed. 7, that is neonatal intensive care unit. It is NICU. It is a specialized unit in the hospital that provides care for the premature and critically ill newborns. When the newborn baby is born, it is kept in NICU, that is NICU. Here, the nurses or the healthcare providers are working to give the right treatment. Here, it is equipped with advanced medical technology and the staff here is very much trained. Significance of pediatric drugs. That number 1 is promote optimized and advancement of drug dose and pharmacotherapy. That the drug and the therapy of the medications treatment should be given to the patient correctly. Second, recognize early signs and symptoms. In the babies, the signs and symptoms should be checked earlier and cured properly to improve the outcome of the patient. Check for the delayed development of the child. Second, any behavior issue if he is having. Third is any illness that is from the long time. It has to be accessed and monitored and cured as early as possible. Geriatrics provide high quality and patient-centered care for older adults. Geriatrics is the elderly patients from the age 65 or the above. These patients need high quality treatment and these patients need the most care like as we care for the children's. Geriatrics is concerned with the issues and its concern. Illness, disease state, safe medication use. As in the old age, there are more issues related to the disease and health conditions. Illness rate is also increased. Disease condition also increased. Multiple disease occurs here. Safe medication use. As multiple medicines are going on with the treatment of the patient, so the drug should not be duplication use. It should be minimized. So previous history of the patient is very necessary to collect in the case of geriatrics as multiple drugs are going on. Common terminologies used in clinical geriatrics. Number 1, develop relation with pharmacist and using one pharmacy can help ensure consistency in care. That in hospital there should be a separate pharmacy for the geriatrics because pharmacists can help in preventing drug related problems. If any drug related issue occurs, it can be solved easily. Risk for other adults. That risk should also be minimized. Dispensing of drugs should be done properly. Provide drug information. Information about the drug should also be given properly. How to take the drug, what are the possible side effects and the causes of the drug, if any ADR, it should be told to the patient. Monitor drug use. Use of the drug should be monitored daily basis. And all these factors helps in ensuring optimal pharmaceutical care. By checking all these steps, we can optimize pharmaceutical care to the elderly patient. Also, the pharmacist should provide information about the drugs, its interaction, its ADR, its prevention, its management. If any drugs is given to the elderly patient, that is mainly polypharmacy occurs, multiple drugs are given, so it should be seen that what are the possible interactions of the previous drug with the new drugs, it should be taken or not. If any serious drug interaction is there, so it should be stopped. Prevention of ADR. ADR should be minimized and it should be managed properly by giving the drug of alternate use. Next is significance of geriatric terminologies. How to take care of the geriatric patient. Firstly, assess patient ability to adhere. That is to set a dose regimen. That drug regimen should be set accordingly to the patient disease condition. If the patient is having any impairment like dexterity is like patient is not aware about any activities, it should be made aware. Special person should be assigned to give him the drugs. Like hand strength. At old age, patients have difficulty in holding the things. So there should be one person who should give the medicines to him by himself. That there should be no fall of drugs. Any cognitive impairments, like at the age of elderly, many problems, learning problems, any thinking problems, remembering issue occurs. So one person should be assigned who should give the drugs accordingly, timely. No footfall of the drug should be there. Vision loss. In elderly people, they are not able to see properly. So one person should give medicines timely himself to him. Second, teach patient. That is, patient should be told how to take the drugs, how to take the inhalers, how to administer transdermal patches, how to give insulin injections, how to measure liquid doses according to the need of the patient. Third is drug supply. That supply of the drug should be accessible to the patient. That bottle should be easily to open. Pills without wrappers. That wrappers of the drug should be separately kept. Only drugs should be in front of him that he can open easily. Fourth is talk in patient native language. That is the language which is easily understandable to the patient. We should talk in that language, Hindi, Punjabi, whatever the native language of that person is. Fifth is drug calendar reminders. That drug should be given to the patient accordingly. That it is to be given, for example, 10 days. So it should be 10 days only, not 11. Properly noted. Next is electronical drug dispensing devices. That is the devices which help us to remind that it's the right time, now take the drug, like keeping the alarms, like I have to take the drug at 2 p.m. so alarm will ring and we will take the drug. It can also be done. Sixth is completing medication realization or to be mentioned. If the patient is taking any previous medications for the condition of hypertension or the diabetes, it should be noted down that there should be no duplication with the new drugs, new condition of the patient. Seventh is drug duplication to be avoided. By knowing the medication realization, we can stop from drug duplication. As we know कि patient is taking the hypertension drug from last 5 years. So, asking the patient history, we can minimize the drug duplication. Antenatal care you get from healthcare professional during pregnancy. It is the care of a mother during the pregnancy. It is called pregnancy care or maternity care. Antenatal care makes sure that you and your baby are in well state. There are the 3 duties that antenatal care provider gives. Number 1 is check the health of mother and the baby. Second, give useful information for healthy pregnancy and advise healthy eating habits to the woman during her pregnancy time. Third is discuss options, choices, care, labor and birth. What are the possible options, choices on how to take care, how to care during the labor and how to give birth, which method of birth to be opted. Second, common terminologies used in antenatal care. Number 1, antenatal. Period of time during pregnancy. It is a time during the pregnancy before the birth of the baby. Second, prenatal. Medical care provided to pregnant women. Prenatal care is the care provided to the pregnant woman during her pregnancy time. Third, obstetrician. It is a doctor who is specialized in care of pregnant women, childbirth, postpartum period. Fourth, midwife. Midwife is a healthcare professional who provides care to the pregnant woman during pregnancy, childbirth and postpartum period. Fifth, fetal development. It is a process by which fetus grows and develops during the pregnancy. In fetal development, we see the growth and the development of the baby during the pregnancy time. Sixth, ultrasound. It is the imaging technique used with the help of sound waves to produce image of fetus and womb. Ultrasound provides the image of fetus and the womb of the baby inside the mother's body. Seventh, gestational period. Age of fetus calculated from first day of the woman's last menstruation period. Gestational period is the calculation of the fetus from the day of the woman's last menstruation period to the last of the pregnancy. Fundal height. It is the measurement of distance from top of uterus to the pubic tone. इसमें क्या करते हैं हम? Measure करते हैं distance from the top of the uterus to the pubic bone, जो help करता है estimate करने में fetal की growth, कि how the fetal growth is being taken place. Ninth, fetal heart rate. It is the number of times fetal heart beats per minute. इसमें मॉनिटर करते हैं fetal कितने टाइम्स हार्ट बीट कर रही है inside the mother's body. Monitoring during antenatal care visits. जितने टाइम भी प्रेग्नेंट वुमन जाती है तो हम चेक करते हैं उसका fetal heart rate, कितने टाइम बेबी का हार्ट बीट कर रहा है. 10th is amniocentesis. It is a medical procedure in which Sample of amniotic fluid is taken from the uterus to check geriatric disorders or any abnormalities. इसमें हम क्या चेक करते हैं? सैंपल लेते हैं कहाँ का? amniotic fluid फ्रॉम द यूट्रस और चेक करते हैं कि दैट जो बेबी है कोई इसमें कोई जेनेटिक डिसऑर्डर तो नहीं है, कोई एबनॉर्मैलिटी प्रॉब्लम तो नहीं है. नेक्स्ट इज सिग्निफिकेंस ऑफ एंटीनेटल केयर. फर्स्ट, एक्सेस माइक्रोन्यूट्रिएंट सप्लीमेंटेशंस, कि जो सप्लीमेंट्स हैं बच्चे को और माँ को सही प्रॉपर तरीके से जा रहे हैं या नहीं. Next is treatment for the hypertension to prevent eclampsia. That in the case sometimes it happens the woman is not hypertensive, but during the pregnancy she get hypertension. So to prevent that. Second is immunization against tetanus also given. Second, also provide HIV testing for the HIV. Second is medication to prevent mother to child transmission of HIV. HIV medicine, HIV vaccine हम इसलिए दे रहे हैं मदर को that it should be prevented, that the child should not transmit any HIV infection. Postnatal care, providing care to women during sixth week time period beginning immediately after childbirth. Postnatal care, in this we take care of the mother and the child when the baby is born from day 1 to the 6-week time period. Continuation of care woman receives through pregnancy, labor, birth and after birth. It includes all 3 points like pregnancy also, labor and birth, and care after the birth. Common terminologies used for postnatal care. First, postnatal period to time after birth of the baby. That is the postpartum period. Postpartum period कौन सा होता है? From the day when the baby is born, after the born of the baby. Second is postpartum depression that occurs after childbirth. Sometimes the pregnant women also experience the postpartum depression after the baby is born. It can be the feeling of sadness, anxiety or fatigue, tiredness. Third is lactational consultant. It is a person specialized in providing support and guidance to new mothers regarding the breastfeeding, how to feed the baby. Fourth, neonatal. It is the period to time after birth up to 28 days of age. Neonatal, it is the time when the baby is born up to the 28 days of its age. Fifth, neonatal jaundice. It is the jaundice which occurs in the newborns, where the skin and eyes color turns into yellow due to the built-up bilirubin in our blood. Significance of postnatal care. That woman and newborn requires proper support and careful monitoring after the birth up to 1 month.